Hello, everyone. Welcome to PharmCast for the Community. I'm your host, Dr. Tim Brown. As you guys know, University of Georgia's College of Pharmacies has been putting together a series of healthcare professionals talking about COVID-19 and what we've been doing in the community to fight this virus and everything that's been going on with our communities. Today, I have two guests on board. I have Kevin Hatcher and Neil Wohlford, who are joining me from the community. Both graduates of UGA, College of Pharmacy. We're proud to see our alumni jumping in. But I brought them on board because I was reading an article recently about testing for this particular virus. And as you guys know, Dr. Suzanne Lester was on last week talking a bit about what they're doing in the medical community. And I thought it was only fair that the pharmacy community got the same representation. Hey guys, how you doing?
Doing well.
Doing great. Good morning.
Good morning. Thanks for coming on board. I know you guys are busy. I know you've been working a great deal, but taking 20 minutes out of your time to educate the public, I think it's going to be a big point to this, because I don't think many people realize that over the course of everything going on in COVID-19, we've been talking about testing, but testing has become, if you will, the counterpoint to this, because we need to know who's been affected, who hasn't been affected, those things. You guys have been working on a mobile unit testing people, is that correct?
Correct.
Tell me a bit about that.
That's correct. Well, I'll defer to Kevin in just a moment to tell about his experience, but as a market director with Walmart, which is somewhat of a district manager, I was contacted back in April and asked if I would be interested in getting in an RV and taking COVID testing out into some underserved communities in Georgia. So I was tasked with that, given the opportunity, and I saw it as an honor and an opportunity to be part of the company standing up a testing unit that could go to where it's needed. So my role in this was to organize swab training of our pharmacists that didn't already have it, assembling a team, compiling all the supplies and resources, and then making sure that that unit was where it needed to be to serve a few of our communities here in Georgia. Kevin's role in it was a completely different opportunity. He was right on the front lines with our patients, so he can tell you what he did in the opportunity.
Kevin, you work for Walmart as well, and you're the lead pharmacist. And where are you working? What part of Georgia?
So I'm a pharmacist in charge in Canton, Georgia. So I have a team of 10 individuals, pharmacists and technicians who take care of patients in Canton.
Nice. And so so I think Neil has hyped it up. What has been your role with this?
So our company asked for volunteers to raise their hand and be crazy enough to go test some patients for COVID. So I was one of those people. I wanted to get my hands dirty and get right in the middle of it. And Neil was nice enough to have me and 24 other pharmacists join him on this journey. And it's been incredibly rewarding.
So Neil, you mentioned this earlier. You had to train people how to swab. To the public out there, how would you describe that? Because I don't think a lot of people who haven't been tested yet know how to get tested. How do you do a test for COVID or for this particular virus?
Well, one of the exciting things is most people don't realize what all their community pharmacists can do. So over the years, pharmacists have gotten more involved in point of care testing, more involved in immunizations. Your local pharmacist, whether it's Walmart or other community pharmacists, can do a host of activities to help you in the community. So what we did is we took pharmacists who were well placed to do this testing in the community. We brought them in. We went through a series of swab testing, both nasopharyngeal as well as mid-turbinate and anterior nair.
All right, stop right
Don't those
there.
sound like scary words?
What the heck does that mean? So I think all those things deal with the nose, right? So basically,
that's exactly right.
So basically, you taught people how to stick a swab up the nose.
We didn't have to go back to their brain, but we did make sure that our pharmacists knew that full gamut of how to do that safely and how to instruct people to do it. And Kevin can talk about what it was like in this specific experience that we had, because we were actually, even though we were trained to do the swabbing, we actually had people doing their own swabbing in the safety of their cars. Kevin, you want to tell them about what that was like?
So we did get to train on multiple different types of swabbing. So we did learn nasopharyngeal, where you actually insert a long Q-tip and rub the back of the throat with it through the nose. So that was really fun practicing on each other. It took me back to my days when we used to practice immunizations on each other back in pharmacy school. But yes, even though this was to be a patient-led screening, we did find it extremely valuable to learn all forms of nasal swabbing not only to prepare us for COVID testing, but also for the possibility of other testing in the future. If pharmacists are ever given the ability to test for influenza, or heaven forbid another pandemic were to come, we wanted to be prepared.
So that brings up a good question. Your preparation. I didn't mean to cut you off, Kevin, but sort of my mind went to that whole thing of, I don't think a lot of people realize pharmacist testing. So this is, I know that we talk about doing it, but this is new for Georgia as well, right? Because of everything that's going on, the Health and Human Services under President Trump have said that pharmacists are frontline providers and they can order and perform testing. Am I getting that correct?
Yes, sir.
So is that what prompted Neil for this RV to head out to test folks and putting pharmacists involved? Was that Health and Human Service edict that pharmacists were certainly credentialed and professionals and they could do these kinds of testing?
Yes, absolutely. As a pharmacist myself, as we mentioned, even though I'm a district manager now, I'm pleased to work for a company that looks for opportunities to serve. And that's not just a Walmart aspect. That's what we do as healthcare providers, is find ways to serve our communities. So when the need became available and there was a gap that could be filled, Walmart saw this, as many other providers do, as an opportunity to help go to where the need must be met and meet that need. So knowing that we had healthcare providers, pharmacists, in our buildings throughout our company and throughout the communities all over the United States, we saw this as an opportunity to provide our pharmacists with the resources to go out and serve their communities. And whether it's immunizations or swabbing or NTM and all the things that pharmacists do, we were just simply well positioned to go out and meet the need. That's what we do as pharmacists, and that's what we do at Walmart.
So, Kevin, it's my understanding this was an RV that went to various communities, and then you worked with patients so they could swab themselves. Is that what you did as a pharmacist? Am I getting it correct?
Yes, sir. My role was to teach and train and support patients as they swab themselves within the safety of their vehicle.
And then when that swab was done, did they get test results immediately, or did you have to send that away? How did that work?
No, sir.
Yeah. Oh, go ahead, Kevin.
Well, so yeah, ideally we would have been able to give them immediate results, but no, sir. We were able to ship the swabs off, get them tested, and get results within 2 to 3 business days.
So, Neil, how long did the RV transverse Georgia and help with testing? How long were you guys doing that?
For about 5 weeks. I would get up on each Monday morning. We would do 2 days of testing here in the Augusta area where I'm primarily located. And then on Wednesday, we'd be in Milledgeville, Thursday and Friday down in Tifton. And I would simply load up at the end of each day and go on to the next site. And the exciting thing is we've been able to graduate this to where each of those cities now, Augusta, Milledgeville, and Tifton, as well as Oakwood and Cornelia, have permanent testing sites now available at our Walmart locations. So people can register, sign up, and get testing between 7 a.m. and 9 a.m. on Mondays, Wednesdays, and Fridays permanently at those 5 Walmart locations in those cities.
Is the testing, once again, overseen or done by pharmacists at those sites?
Absolutely. Yes, sir.
So, Kevin, it sounds like you really, and I have to admit, coming from primary care, I'd have been all over this too. I would love the opportunity so kudos to you for jumping in. How many tests did you get a chance to do, Kevin, or oversee? How many people did you help? Do you know?
I would estimate maybe 400 to 500 tests.
That's amazing. Just kudos for stepping up and doing those things, especially with knowing that the state of Georgia right now with pharmacists, this is probably not a mainstay that we've seen with our board. And this is really working out to show the level of professionalism and also the amount that our profession has changed over the last 30 years to show pharmacists have the ability to do these things. Now, the RV is no longer working, right? You guys have set up permanent testing sites. Am I correct, Neil?
That is correct. And my wife appreciates it. Yes, sir.
But at the same point in time, as you pointed out, you've taken this, excuse the term, this rolling test machine and turned it into a place now where in all those towns, there's actually a stable, stationary place where people can go at certain times of the week and get tested, correct?
Yes, sir. Yes,
Kevin,
sir.
are you testing at your particular store?
No, sir.
Is that something that Walmart's looking at doing, is branching this out a bit more to test at the stores across the state?
I think we have the capability to expand, but a lot of the sites are based on need and our partnership with Health and Human Services and state and local officials. So, it's not necessarily up to us where we test. We're just available. This is something that we're volunteering and donating our time for. We're available when necessary.
I asked that question because what I'm hearing is that as we sort of roll out more testing sites in more places, and obviously more professionals who can order and do the testing, that's going to be one of the cornerstones to how we manage the virus and the spread of the virus. And I like the fact that we have people in the community that have access. I mean, everyone knows where a Walmart's located. Everyone knows where other chain drugstores are located and independent pharmacies. And I'm just sort of trying to get a feel for our community out there, for them to know that they can look to see if their pharmacist is testing right now. So is there a way to call and find that out? How do they know if their local pharmacy or local Walmart's offering testing?
Well, we do have a website with our clinical partners at eTrueNorth, and it's a real simple website. You can go to doineedacovid19test.com. And there you can see what locations, and in all fairness, there are a number of locations that aren't Walmart pharmacy locations. So there's some independent pharmacies. You can click which state you're in to see if there is a testing facility near you. And all of the testing facilities that you access through that website and our eTrueNorth partners are going to be no cost to the individual. You don't have to enter any of your healthcare information. You don't have to enter any insurance information. Again, it's a partnership between Walmart, eTrueNorth. There's another provider, Quest, which is a big diagnostics organization in other states. But in Georgia, we partner with eTrueNorth. You can go to their website, and they will walk through the qualification questions, which are decided upon by CDC recommendations, as well as your state and local healthcare providers, or the state and local municipalities deciding who gets tested and who doesn't. But you'll walk through the qualification questions, get a voucher for a test, and then in any one of those testing locations throughout the state, you can be tested for free.
So what was the name of that site again? It sounds really simple. I should remember it, right?
It is real simple. It is doineedacovid19test.com.
Got it. Okay, if a blonde Southerner like me can remember that, anybody can remember that. Okay, very good.
Absolutely.
So we're seeing, as you point out, more pharmacists rise to the challenge. We're seeing people from, as you point out, it's Walmart, it's other chains, it's independent pharmacies. So there are places that you now can get tested that maybe weren't on the scope even 6 weeks ago, because we're seeing pharmacists step up to this challenge. So, I love the fact that it's free, so to speak, that it's not insurance, it's there, it gets done. So that's nice to know as well. Kevin, I guess the other side of the coin is, I know working in your capacity at Walmart, you see patients every day. What other services? I've heard Neil talk about immunizations, those kinds of things. I think a lot of people equate flu shots with, the pharmacies. What other things do you offer your patients besides COVID-19 and counseling and immunizations?
So we also offer point of care testing at certain times during the year, where we're able to check blood pressure, check cholesterol, and do blood glucose screenings for patients. So that's something that we're delving into. We also, of course, offer year-round immunizations, whether it's for shingles or we offer tetanus shots, any number of immunizations that we are able to provide, we do provide.
Now, you offer immunizations for folks. What age do you start giving shots in the stores? At what age can I bring can I come in?
So it depends on the immunization, of course, but I believe for flu shots, we're at 14 and up currently.
Got it. So in other words, I guess a lot of people I've been talking to are afraid to go to their physician's office because they don't want to sit in the waiting room because of everything going on. So it's potentially they could, at their pharmacy, spend time with their pharmacist to get some testing done, or to ask questions, or to use them as a conduit back to their primary care physician for questions they may have. Is that a fair statement, Kevin?
Yes, sir. Yes, sir. That's one of our major roles right now. Especially at the height of the pandemic, that is something that the pharmacists took very seriously, trying to keep people out of the hospital, out of their physician's office, and treating them with over-the-counter medications and providing that expertise to keep them safe, as safe as possible.
So I think, looking at the way people live today, we want it and we want it now. We don't want to wait in line. We don't want to wait 6 weeks for an appointment. We want to be able to walk in and gather what we have. It sounds like the access to care at community pharmacies is really quite high. I mean, you sort of have access no matter which community you live in. You have a pharmacist at every place. And then, as you point out, that some places are now testing centers, which I think may expand as time goes by just because of the need that we have. So, Neil, I guess if I had to ask, if you had to tell the community 3 pearls about what pharmacists are doing in COVID-19 or how they're helping patients, what would you say?
Well, I don't know if this is going to be one of my pearls or not, but one of the themes that you keep hitting on is I don't believe that there has been anything asked of pharmacists that they have not been able to deliver and deliver in spades. So one of the things I would tell you is people need to realize not only are we one of the most trusted professions out there, but there isn't anything that we can't do in serving you. And as society begins and as the politicians and the legislators begin to realize what type of services we can perform right inside of the community with the people that know us and trust us and we see regularly, I think one of the pearls would be understand what your pharmacist can do and talk with them about having it done for you. That's one of the pearls. The second would probably be understand the array of services that are available. So it's not just that you can trust your pharmacist to do those, but understand what all they can do. So speak with your pharmacist about what those services are. And then also, I'd love for every member of society to recognize specifically to COVID is that we all do need to be tested. Currently in the state of Georgia, our governor has decided that everybody needs to be tested, and by golly, everybody needs to be tested. So whether you feel like you're sick or not, by testing everyone, we can cast that net to understand where the pockets of the infection are so that we can best treat it, whether it's self-quarantining or understanding within a particular community how we need to act or react to where the infection is currently residing. So get tested would be the last point I would want to make.
That's a very important one, a good one. All right, Kevin, 3 pearls. What would you say?
I probably took them all. Sorry, Kevin.
You stole all my thunder. So I would just say that the community pharmacists sometimes don't get the credit they deserve. We can do amazing things taking care of patients every day, but there's always room for growth. And community pharmacy has grown a lot in my very short career, but there's always ways to reach a little bit higher, do a little bit more. And this was an opportunity to raise my hand and say, I'm a community pharmacist and I want to be a part of something special, a part of something groundbreaking. And I think that we've created a really great model to show what community pharmacists can do, whether it's in a retail setting or elsewhere. My second pearl would be that pharmacists and other medical professionals are leaders in the community, and we need to look at ourselves that way. And when given the opportunity, it's our duty to step up sometimes and do what's needed and what's necessary. And I was glad to be a part of that. And then my last pearl for pharmacists and for anyone is don't be afraid to practice something called Kaizen, which is a Japanese business philosophy where you throw out an idea and it may only be 80% right, but through teamwork and through meeting with your team, you can reach perfection or get as close as possible to perfection. And that's something that Neil and our company did a really great job of. After every single COVID testing site, Neil would sit down with all the pharmacists and we'd say, hey, what did we do right? What opportunities do we have? And then we would work together to perfect the process. And COVID has forced a lot of different businesses to do that right now. We're all kind of flying by the seat of our pants every once in a while. And I just think that in this particular case, Neil did a wonderful job of working with the team to perfect this process.
No, I love that. I like that philosophy too. I think the other thing that we haven't brought out here that I want to mention is that as a community pharmacist, you work within a healthcare team. So while we're talking about screenings and immunizations, those things, they don't happen in a bubble, that there's communication back to the other team members, primary care, those kind of folks that also are in the patient's life as well. And I know that you guys build those bridges every day, and you have access to a lot of different healthcare folks that you can talk to pretty quickly and get good information for patients as well. So, for me, watching this expansion in Georgia and watching pharmacists step up to the front lines and ask to sort of answer the call of duty is wonderful. I'm waiting to see how this goes. I get more and more pharmacists talking about testing and access to testing, and the number of people flocking to their community stores to get this done. I think we're seeing the ability of pharmacists to provide care beyond what many people realized. And you guys are certainly an example of that, and I appreciate you being here today. So, any final words from either of you heroes?
Go Dogs. I hope we have a football season.
Amen. Go Dogs.
Eventually they're going to accuse me of only bringing on pharmacists from UGA. I've got to branch out and look for others. But at the same point in time, the Go Dogs philosophy is certainly on there. So we'll see what football season holds for us this year. Guys, thanks again for taking time. I really appreciate it. And thanks for all you've done for our communities.
Thank you, Tim.
Thank you, sir.